Welcome to a special Frontiers Health episode of the Pharma Forum podcast. This is your host, Nicole Raleigh, and in order to mark the 10th anniversary of Frontiers Health, Pharma Forum is running a short series in the run-up to November, speaking with experts in their field about their favourite memories from the conference over the past decade and the future of health more generally. In this episode, I'll be speaking with founder, director, and global health advisor at D Health Consulting, Roberta Sarno. Roberta is also director of the APAC Liver Disease Alliance and consultant on digital health APAC policy at the American Telemedicine Association, as well as advisor to the Asia Pacific Medical Technology Association. Welcome, Roberta.
Thank you, Nicole. And it's really a pleasure to be here. Thanks a lot for the invitation. So my name is Roberta. I'm the founder and director of D Health Consulting. I think, my journey has always been shaped by one constant passion, which is making health systems and health innovations more equitable and accessible. So I started my career in biology, but actually after a PhD, I realized that I was more driven by the question of how innovation can reach patients rather than the science itself. And plus, to be honest, I had too little patience for academia. So that led me to consulting and leadership in the medtech and pharma industry, and then later on to global health. And, today I work across Europe, the Asia Pacific, the US and the Middle East. And eventually I built my own consulting practice to focus on multi-stakeholder collaboration. And I spend most of my time trying to bridge healthcare companies with academia, patient advocates, policymakers, and clinicians.
Thank you, Roberta, for that introduction. So if we hone in on this concept of global health, as listeners of this special Frontiers Health series will know, Frontiers Health is hosted and powered by Evasana, and it is a conference which has emerged as one of the premier global health innovation events, with a strong focus on digital therapies, breakthrough technologies, healthcare transformation, investments, and ecosystem development. Frontiers Health provides an opportunity for practitioners of disruptive health to engage in highly inspirational, informative, grantedly sometimes controversial sessions and conversations, all of which are intended to provide companies, entrepreneurs, and venture capitalists with a useful roadmap, key insights, top-level learning, and unparalleled networking. So my first question for you today, Roberta, what has been your favorite memory from a past Frontiers Health conference?
Yeah, thanks for the question, Nicole. And I'll say that straight away, right? So Frontiers Health is really one of the best conferences for me. I think, thinking about the best moments, probably there are two things that come to my mind. So number one, the energy that I felt the first time I attended Frontiers Health in person. So that was in Rome. And I clearly remember that feeling, right? Walking into a room full of people with the same energy and passion for healthcare. And also, I think something that was a little different compared to other conferences is that people were not afraid to share their learning, but also their challenges, right? So usually when we attend conferences, we are used to hear stories of what worked. But actually, the most interesting conversations that I had at Frontiers Health came from people who were able to share their pain points. And, that ability to challenge the status quo is really what, for me, makes a difference and make Frontiers Health unique. So I think it's not only a learning opportunity, but also, give me every year the possibility to come back home with some ideas of concrete next step that I can undertake in order to move the needle a little bit more. So I think that's really unique. And it's not only about being inspired, but also about getting some practical tools and ideas and recommendations. So that's the first part. And then probably there is something else that is a little bit more personal, which is, related to the possibility to meet people in person. I've been working with the colleagues from Frontiers Health and now Versana for a long time before actually being able to attend the conference in person, because at the time I was in Singapore and it was during COVID. So we started to collaborate, but actually we never met in the real life. And I really remember that moment where we met in person, and that meeting in the real life was really transformative. And during and post-COVID, now we are all used to work remotely, and personally, I enjoy doing so, and I spend, relatively, I think maybe 70 or 80% of my time working online with people. But I think, that relationship that is built or reinforced in the real life is so critical. And it's important to keep the human connection. So for me, Frontiers Health also became the opportunity to have that annual meeting with people I collaborate with. So I think, that combination of really global reach and in-person trust building is something that Frontiers Health does really, really well.
Absolutely. As you say, it is one of those conferences that challenges the status quo and is quite unique when it comes to its face-to-face networking capabilities. So if we stick with Frontiers Health and think about its ethos, I was wondering, Roberta, whether we could now discuss the importance of equity and accessibility, which you mentioned earlier as your passions for patients, and how that needs to be something considered from day one. What can you tell us about the, for example, impact of this thinking on rural communities?
Yeah, and actually these topics are not only critical for our industry, they're also very close to my heart. And I really spend a lot of time working and trying to advance equity and accessibility. So I think maybe, it's if we go back to the definition, right? Accessibility really means removing the barriers that prevent people to utilize a given health technology, innovation, a drug, a medical device, a diagnostic tool, whatever. And equity is about being fair and making sure that same technologies are able to reach the exact population or subgroups that need them. So I think, when we talk about digital health, it's really easy to focus on the most advanced solutions. Sometimes, they are very well integrated and working pretty well in, let's say, big urban hospitals. But for me, the real measure of success is something like, can a woman in a rural village or a worker in a remote area access that same level of care? So I think, when we talk about innovation, for sure, innovation and digital technologies have an enormous potential to close the gaps. And we think about telemedicine, enabling, people to consult a physician, even if they live far from the city center, or point of care diagnostics, where we are able to test people for a given disease close to where they are, rather than inviting them to travel to the city center to access the diagnostic laboratories, or remote monitoring. But I think, it's really important to understand and to keep in mind that there is an entire ecosystem that need to be there in order to favor that accessibility in an equitable manner. And I think we can only fulfill that need if we think a little bit broader. And this is why I think you're totally right. Accessibility and equity are two components that need to be evaluated very early, right? Otherwise, we risk to create a two-way, a two-speed system where we have the best innovation for a few often wealthy people, and then inequality for the rest. So we really need to think about, okay, beyond the innovation and beyond making sure that our technologies are safe, effective, are we also enabling policy to create the environment for technologies to reach the patient? Are those technologies reimbursed? If nobody's paying for them, there is something that doesn't work, right? And we can't leave that choice to the patient to have to pay out of pocket. is the infrastructure ready to support integration of those technologies? So I think all of these questions are very important. We can't address them when the product is already on the market. And I think we can't address them from a unique point of view only. And this is where I think, that collaboration between different actors in the healthcare industry is so important because, the healthcare company is there to innovate, but then they will need the policymaker to enable that innovation to actually reach the patient. So I hope I answered your question, but I think it's a very critical component of enabling access to care.
Yes, totally. And we'll come back to the benefits of the collaborative approach, but let's focus on the word policy. It's a word that is ever on industry's lips. And indeed, this year will mark the third year that Frontiers Health has run the Global Digital Health Policy Summit. So, Roberta, could you share with us the importance of such informing this health ecosystem as enabler, as we've been discussing in this conversation?
Yeah, sure, Nicole. So first of all, I'd say typically, okay, not always, but typically, conferences for the healthcare industry are not conferences for the policymakers, right? So when we think about conferences in the healthcare industry, we usually think of, a panel discussion and dialogues targeting investors or startups or pharma companies, but not much the government officials and the policymakers. Usually there are two different separate fora for these discussions to happen. And I think, so first of all, it's really great that Frontiers Health has been able to bridge these two groups, right? So there was a clear need. Why is that important? So I have an example that I was having this discussion with a colleague, a woman, and a policy expert a couple of months ago. And she brought a metaphor that I'm going to share with you. And she said, policy is critical because innovation without policy is like having a car without a road. And actually, that's true, right? It's a very simple metaphor, but I think it summarizes really the importance of bringing the policy discussion and the innovation discussions in the same room. If you don't address the question of policy, you can have the most, technologically advanced, developed, fast car, but that car will never be able to reach the patient, right? So, and in the same way, if we think about health innovations, companies can develop brilliant, solutions, very advanced digital health technologies. But if the regulatory frameworks are not fit for purpose, if the reimbursement models are not adequate, if data governance is not ready, then these solutions will never scale. They will remain pilot, but they will never reach the entire population, which eventually it's the reason why innovations are, take place. I think what I appreciate about this initiative and this, Global Digital Health Policy Summit that now is going to be in their third edition is that it's really a unique space for policymakers to discuss with innovators and government officials to discuss with pharma leaders and so on. So we need more space like that. And the opportunity is really to showcase that policy is not, is not a barrier. It's an enabler of innovation. And if we want innovation to succeed, we need the policy to be ready and to make sure that that innovation is going to reach the patient in the best possible way. So I think by creating this global, open, and multi-stakeholder dialogue, Frontiers Health has been able really to align not only different stakeholders, and let's put it simple, the private and the public sector, but also different regions, right? So I think as a result, we have been able to see impact globally and to move faster collectively. So, we really need governments to set the vision. We need the industry to innovate. We need the clinician to validate that the technology is actually working. We need the patient to give feedback and then to inform the process again. And then, of course, payers to sustain. So all these people need to be in the same role. So, yeah, I think Frontiers Health has been doing that so well that we have been able to also follow collaborations after the summits in the different, in the past couple of editions. You can see, government officials, regulators, or policymakers across Europe to build collaboration, but collaborations that were actually originated at Frontiers Health. And we've seen regulators from Malaysia sitting in the same room of regulators from Germany and sharing what's the pain point, what can we learn, what is working in my jurisdiction, what can we learn from other regions, and so on. At the end, we need a global alignment, and to do so, we need to bring the right people around the table.
Absolutely. As you say, it's a space for conversations that promote tangible transformation, actual action. So my final question today, Roberta, what is one word or phrase that, in your opinion, will define the future of health?
Yeah, Nicole, actually, I've been thinking about this a lot as I was preparing this podcast, right? And I thought, okay, should I say digitalization? Should I say personalization of care? Should I say prevention or data-driven, innovation? And then at the end, I decided that I will go for inclusive innovation. And I will tell you why I think that will need to be, in a way, the future of health. It's because I don't think we need any more to highlight the advancement and the progress. The advancement and the progress of our industry is already there. We already have the tools. We already have the technologies. For most of the therapeutic areas, not all, okay, there are still a number of neglected diseases, unfortunately. But for most of the therapeutic areas and diseases and health issues, we do know how to prevent, monitor, diagnose, and in the best case scenarios, treat a given disease or disability. Now, what we need is to make sure that all of this reaches everyone, right? So it's about ensuring that the beautiful innovations we have are able to reach that woman that we discussed about earlier on in the village, or the man in the rural community, or whoever doesn't have the adequate level of education, of resources, or someone who is still facing stigma associated to their disease, and so on. So it's not about reaching the privileged few and be able to demonstrate how an innovation works through a very well-designed pilot. It's actually to scale. And to scale, we need all of that elements that we saw today together to work and to interact with each other. So innovation, equity, access, policy, reimbursement, payment models, and so on. So I think if in, let's say, 5 years from now, we will have been able to make innovation more inclusive, I think we will be at a point where technology will be more able to serve humanity and not only just a small population or a small subgroup of the entire population.
There you have it. Inclusive innovation, removing barriers, bridging the gaps, and permitting a healthy future for all. Thank you very much for your time today, Roberta. It's been a pleasure.
Thank you.
And that concludes another episode of the Pharma Forum podcast. You can find more information about this episode, including a download link and information about previous installments, at pharmaforum.com/podcasts. The Pharma Forum podcast is also available on Apple Podcasts, Spotify, Overcast, Pocket Casts, Podbean, and pretty much wherever else you download your other podcasts from. Just search for Pharma Forum and follow and hit subscribe. Of course, don't forget to visit our website itself, where you can sign up for daily and weekly news and analysis bulletins. And do follow us on Blue Sky and LinkedIn at Pharma Forum. That's all for now. Thank you for listening.